Downturn is being felt beyond Alberta's borders, and experts worry the added stress on the Canadian economy threatens everyone's mental health. Katy Kamkar is with the Centre for Addiction and Mental Health. She calls it a vicious cycle.
So when we hear of staff cutbacks, job cuts, loss of employment, fear and anxiety increase, especially with the uncertainty when we do not know about our future.
Economic hardship can trigger or exacerbate mental health issues. In turn, mental illness damages the economy through lost productivity and added healthcare costs. Even more reason for companies to monitor for signs of trouble. That's according to the chairman of Barclays Capital Canada, Michael Wilson.
They should be bringing their management together periodically and asking the question, is there anybody on your staff who we should be concerned about?
BNN's Paige Ellis is here with more on the interaction between the economy and the mental health of Canadians. Paige.
Well, you can really understand why this would impact the unemployed. And certainly what I'm hearing in my conversations with mental health experts in Alberta is that they are seeing a number of people actually explicitly mentioning to them that the reason why they're seeking help is because they've lost their jobs. And in fact, that counseling center that we looked into for this report, it has actually put together some support groups for people who have lost their jobs. This is not to help people find work. This is to help people deal with the emotional ramifications that come with a job loss. But what's interesting is it's not just people who lose their jobs that are affected. It's also people who are not pink slipped. And this is something that really came out when I was speaking with Katy Kamkar at the Centre for Addiction and Mental Health here in Toronto. She said that the people who are still at work after their colleagues have left experience a great deal of guilt and sadness for seeing their friends and colleagues go. And in fact, she also said that there's a great deal of pressure on the people who are left behind. Have a listen.
People often report increased workloads and demands, often also with fewer resources. So when we have increased demands and we don't perceive as having enough resources to cope with the demands, it does compound the stress.
And that compounded stress, when prolonged over quite some time, that is when we are vulnerable to some psychological disorders.
Yeah, Paige, you mentioned unemployment or the unemployed. Are there any other groups, any data that suggests other groups are perhaps more vulnerable than others in times of economic stress? Yeah,
absolutely. So when we look especially at Calgary and Alberta broadly, Calgary is a boom-bust town. This is something that a lot of people have become accustomed to over the decades. But younger people, as suggested in that report, younger people haven't necessarily seen the bust followed by the boom. So they might not be able to see the light at the end of that tunnel. So a lot of mental health experts in Alberta are very concerned about that group. Another group is actually the older generation of men, because their jobs, and this is the case for women, jobs are often tied to your sense of identity, but that's especially pronounced in older men. A third group would be couples. Let's say one person experiences a job loss, or perhaps both. That's a lot of stress on a relationship, so counselors are very concerned about that group. I do want to mention in the workplace that there's some signs to look for in case you are worried about a colleague, things to watch for, warning signs. Absenteeism, if someone is frequently late for work, you find they're withdrawing from colleagues or they appear less productive. These are things to look out for. And I want to mention, of course, suicide. Just bringing that up can be very triggering. There are some resources. I would point people to cmha.ca or suicideinfo.ca if there are concerns or you want to learn more about this topic.
Thanks, Paige.